We are diving deep today into something really significant: maternity, but we're looking at it through a pretty unique lens,
Yeah, we're unpacking the operational guide for Sharewell.
which is a health sharing community. And we should be really clear right up front: this is explicitly not insurance.
Exactly. And that's the mission here, to give you a clear, step-by-step roadmap for using their maternity sharing requests. It's a nonprofit where members voluntarily share costs.
And that lack of regulation, it brings up a big question. If it's outside the normal insurance system, how does it stay reliable?
That's the key question. And the accountability seems to come from the community itself, this shared goal of keeping costs down for everyone.
So let's get into it. First things first, there's a simple but really crucial eligibility check.
Yes, the pregnancy has to be confirmed to have started at least 30 days after your membership start date. And you need to submit those clinical notes early to get the ball rolling.
Okay, and here's where the strategy really comes in. When you talk to a provider, you have to present as a self-pay patient.
You absolutely have to. This isn't just some rule. It's really the secret sauce to making the whole model work.
Okay, so wait, why that model? Why force the self-pay thing?
Well, it immediately unlocks two huge benefits. First, you get to bypass all those restrictive PPO networks.
So total freedom. You can choose any doctor, any midwife, any hospital.
Any provider. And second, and this is the big one, it unlocks these really steep cash discounts that are often way, way lower than what insurance companies pay.
Got it. So once you're set up as self-pay, you ask for the provider's global maternity package.
That's the one. It typically bundles all the main stuff: prenatal visits, routine labs, the delivery itself, and postpartum follow-ups.
But like with anything, you have to watch the fine print. Things like anesthesia or maybe extra ultrasounds beyond the standard 2, they often fall outside that package.
And because that can get tricky to navigate, Sharewell gives you backup.
Right, the dedicated maternity coordinator.
Exactly. Once you're approved, you get paired with one. This person is your advocate. They help with logistics, billing questions, even finding providers who get this model.
Now let's talk about what really makes this community different, and that's the holistic support.
This part is huge. Sharing eligibility goes way beyond just standard medical care.
We're talking about acupuncture, chiropractic care, pelvic floor therapy.
And the big ones: doula services and midwifery. This gives you the freedom to choose care that really aligns with your values, which is, well, it's often just impossible with a traditional plan.
So how does the money flow? It all centers on your unshared amount, or UA.
Right.
So to make sure I'm tracking, the UA, is that basically like a deductible?
Functionally, yes. It's the amount you're responsible for before the community starts sharing. And because you're a self-pay patient, Sharewell really encourages you to prepay with providers to lock in those lower rates.
And there's a $6,000 allowance just for those pre- and postnatal expenses.
It's pretty generous.
The real power here, I think, comes out in that financial case study they provide. Let's compare Jane, the Sharewell member, to Jillian on a traditional plan.
Okay. So both of them had about $9,100 in total maternity services. And that included holistic care, like a doula and chiropractic.
So Jillian, with a $7,000 deductible, she ended up paying $6,100 out of her own pocket.
A huge amount. Now Jane, with her $1,500 UA, paid only $500.
$500? How's that possible?
Because of this amazing incentive. It's a shared savings bonus. If your entire maternity sharing request stays under $10,000, Sharewell gives you $1,000 of your UA back.
Wow, so that's a saving of over $5,600.
A massive difference, especially when you're bringing a new baby home.
And as a final, just really human touch, they also provide 6 months of diaper delivery after the birth at no extra cost.
It's all about that continuous support. So the core value is really about choice, financial clarity, and that community coordination.
It just fundamentally supports choices that most plans would call a luxury, like a doula or a home birth.
Which brings us to the final thought for you. Sharewell has this philosophy: if you think wellness is expensive, try sickness. So considering the incentives and this real focus on holistic preventative measures, how does this health-sharing approach fundamentally shift the way we value and invest in health, moving us from just reacting to illness to proactively funding well-being?